Welcome. Join us as we follow Staff Sergeant Joe Garcia on his health journey. Sergeant Garcia is a 30-year-old who proudly serves in the United States Army as an 11 Bravo infantryman and has been on active duty since 2005, including a deployment to Afghanistan in 2014. He recently suffered a shoulder injury during a training exercise on a night jump. Using swift action, his unit successfully stabilized and evacuated him to a local military treatment facility for further evaluation. Upon arrival to the nearby facility's emergency department, which uses MHS GENESIS, Sergeant Garcia was treated with timely and excellent care. The emergency department tracking board helps streamline the communication between the care team while providing real-time updates on all lab and radiology orders in the same view. The emergency department nurse saw real-time lab and radiology results post and expedited notification to the emergency department physician. The care team was notified immediately that the result of the shoulder x-ray was negative, and Sergeant Garcia was soon discharged with prescriptions for Ultram and Motrin. He was told to follow up with his primary care manager within 72 hours. Over the next 50 minutes, we will explore how MHS GENESIS streamlines communication across the continuum, improves clinical efficiency, and facilitates patient engagement. Join us as we follow Sergeant Garcia on his journey back to health and readiness.
Good morning and welcome to CHC. We're excited to share with you the MHS GENESIS configuration. You've just heard that Staff Sergeant Joe Garcia sustained an injury on a field training exercise. And Stephanie Hermrich and myself, Megan Poland, will be your narrators on his journey back to health and readiness.
Thank you, Megan. And as we already know, Megan, Sergeant Garcia had been in the ED recently, but he's back home, luckily, in the comfort of his own home, sitting on his couch, and we're going to go ahead and hop in with him to his patient portal to start. Now, upon logging in here, he immediately sees those results pulling in over here on the left-hand side. Now, with logging in here on his home screen, he's got that dashboard view across the top there, quick access to all of the links that are pertinent to him as he's viewing his health record information.
Now keep in mind that today we're taking a look at this on the desktop view, but we know that your service members and their families are on the go, just like the rest of us. So know that they have access to this no matter where they are, on a mobile device, as long as they've got internet or cellular data.
Now, and looking at his health record information, as we mentioned, he'd been in the ED, so he's immediately going to look at those discharge instructions today that he has right within the health record. Now, after viewing those discharge instructions, he remembers that the ED provider did let him know that he does have to get that follow-up appointment with his PCM taken care of. So we're going to take care of that here in a second. But after looking at those instructions, he also wants to take a look at those medications as well. And looking at those medications he's prescribed to recently, that Ultram tramadol that he was given in the ED, hasn't really ever taken that before, so he does want to look a little further into that information that's provided for him.
Yeah, notice that there's a link embedded right within the patient portal. We're sending him out to a reputable site so that he has access to appropriate information. No longer are your service members and their families going out to Google and trying to find that information themselves. We're getting them to the right spot at the right time.
So after reviewing those medications, that Ultram specifically, he does notice he has a message available to him. In that dashboard view, he has that indicator, so he knows when he's getting those new messages from his care team. Now, in looking at his inbox, he notices his cute little son, Owen, has a well child exam appointment coming up. He notices that he can see this information in here without having to log in or view from a separate portal or view here.
Gosh, he must love not having to remember multiple different passwords for this.
Absolutely. Now, while in the inbox, he remembers, well, I've been developing this rash recently, and he loves giving that communication to his care team. So he's going to go ahead and create that message so that he can send that communication over to them before scheduling that appointment. Now, in being able to communicate over to the care team, he's going to be updating about this rash that he started to experience after the ED, and instead of having to type out the description, he's not even sure what's going on. It's on his back. He doesn't know. He can't really see it. He's going to go ahead and take that quick picture. And heck, Megan, he may even have his wife Lindsay or his little tech-savvy son
hard
Owen.
angle there.
Yeah, I know. That selfie angle's not quite there, is it?
Yeah. I'm guessing maybe he needs a selfie stick.
Yeah. Put it on his Christmas wish list this year. It's coming up. So in taking that picture here, he can quickly send a little message over and let them know what's going on. And after taking care of that message today, he's got to do one more thing. The reason why we logged in here today, he's got to go ahead and schedule that appointment. Now, in scheduling that appointment with his PCM here, he can quickly access all of his appointments from his patient portal. Now, we know today that some of you are utilizing booking of that direct online booking of your appointments, but no longer are you having to worry about going out to TRICARE online and having to go to a separate view from your patient portal. Sargent Garcia can have this information and book this appointment all within his patient portal.
Note that clients like you have used this type of functionality of letting their patients directly book online. In fact, the University of Missouri, right down the street on I-70, they saw a reduction by 30%, or 30% reduction in no-shows just by implementing online booking.
I think even when Sargent Garcia is up early, maybe for his PT like some of you, it's great for him to access these appointments at any time and not have to wait for that clinic to open up to give them a call.
Now that he's got that appointment scheduled, we probably want to fast forward here just a little bit. I promise he's not fast forwarding too fast, no speeding tickets on the way over to the clinic, but he does arrive relatively quickly there, and as he approaches the front desk staff uses a tracking board to keep track of all of the patients that are coming into the clinic for the day. This tracking board is helping call attention to who's currently in the office, using timers to remind us when patients have been here for too long in that process here. Now, as he does come up to the front desk, we're going to quickly confirm, make sure that we've got the right patient here on the list. As we review his information, we're ready to go ahead and check him in. Now, the nice thing is that as we're checking in Staff Sergeant Joe Garcia, it's automatically going to run the DEERS eligibility check. So no longer are we having to call or log in someplace else in order to have that completed. On top of that, we can even update demographic information, whether that's a new cell phone, or I know a lot of you change addresses often. We could update that information, and it ensures that it's updated in both places.
Megan, I think that staff at DEERS is going to miss our phone calls, though.
Don't worry, if we still want to chat with somebody, I've heard the folks at Zappos are trained to chat with customers, so we can call them instead. Now, as we've done this, it's gone ahead and it's updated the status for us so we can see that he's now in a checked-in process. Now, this doesn't just mean that the front desk knows that he's checked in. It means that the entire clinic knows that he's checked in. So we no longer have to go back and find that medic. In fact, they know right away that this process has begun and the timer has been started.
Now, speaking of that medic, we're going to go ahead and switch over to look at that medic view here. Now, upon logging in, we're going to see that home screen available to us. So I'm always there early. I'm kind of an early bird, I guess. And as I'm viewing my screen here, I can immediately see that status update. And as Megan had mentioned, that's pulling over from the front desk. I love talking to my front desk staff, but no longer am I going to have to worry about having that conversation. I can see it updating real time here. Now, speaking of that communication there, we can see that message center on the left-hand side. Now, we remember Sergeant Garcia sending that communication over to us. And as the medic, speaking of me getting there early, I'm always the one in the leading of the medic pool.
You're so competitive.
I know. I'm always checking, not to brag or anything, but I'm always the first one to check our patients' messages they're sending over to us. So speaking of that, Sergeant Garcia did send over that rash picture for us to review.
Ooh, that doesn't look too good.
Yeah, it's not looking very good, Megan. I think we probably should go ahead and get that in his chart and make sure that that's there for Dr. Jackson to see here in just a bit as well.
Even though that doesn't look pretty, it's great that it's right here within our medical record. No longer are your clinicians having to go log into Relay Health, review those messages from there, and then go back to the patient's medical record. In fact, they're right here, a part of that workflow in that message center, and you'll notice we even saved it to the patient's chart so that we have a running record of all of that communication within the chart.
So back in viewing that message center, as well as the list of patients that are coming into our clinic today over here on the ambulatory organizer, we can see a lot going on there. Not just the list of patients, but some details of their visit and that status. Once again, we see that Sergeant Garcia is ready, checked in, and for us to come grab him from the waiting room. So speaking of that, let's go ahead and pull him back into the exam room and get this visit started. So upon logging in here, we can see that quick snapshot view of his chart. We can see the ED information pulling in from his recent ED stay. But we're going to go ahead and start that vital process here. As we're documenting that and capturing that information, we can also see that we're going to be updating some of this, the pain that he's still experiencing. He mentions he's still got a little bit limited mobility, a little swelling going on. He even mentions that the pain is about 4 or 5. And Megan, we know Sergeant Garcia pretty well, and he's a pretty tough guy. I think that's pretty unusual, so we want to ensure that this information's all right within here.
Now, this is really nice that we're able to capture all of this information, but the big thing that I want you to take out of this is, do you notice that Stephanie is completing this electronically? We're not doing this on a piece of paper and then entering it into a system later. We have access to this and we're reviewing, updating the current information, adding the new information in, and that's going real time into that record so that when our physician sees our patient, we're not having to hunt and peck for that data.
That's right. So moving along, capturing this information, we also were talking to him about that rash. Once again, he's asking if I received that message. Of course I did. Saw that in my message center. I brought that into his chart here. We're talking through that. He does mention that it started when he had left the ED and was taking that Ultram, and then even noticed after he was done with taking that medication that it started to go away a little bit. So we're starting to think
we should probably add it in as an allergy just to be safe.
Just to be on the safe side. I think we do need to add that in, and we can verify that source of patient recorded here. And all this information is going to be available so Dr. Jackson can review that as well. So upon being able to capture that reaction, he has that rash on the back, we can go ahead and update that allergy today. Now, after updating that allergy, we also want to capture that social history. This is pertinent for Sergeant Garcia. Last time we saw him, he was a current smoker, and honestly, when I was bringing him back to the room, he kind of smelled pretty heavy of smoke.
Oh, Steph, let's not be too hard on him. We've learned a lot about our service members, and if I were doing any of the things that they're doing, like jumping out of planes, I'd have a lot more vices than that.
I agree. All right, after capturing that social history, we also can update any other information in here, like that PHQ-2. Upon him coming to his visits, that's going to be trackable and trendable over time as we calculate that score. And if we need to review anything like the PTSD screening, we could also do that. Notice we have stayed within one view, single view here.
That's great. You're not having to go someplace else. If you need it, it's here, and you don't have to jump around.
I think it's time to go ahead and make this part of his chart, update this information, and as we head back out, we can see that that status is once again changed from checked in to seen by medic. So I think our physician, he's pretty good at checking in on his patients before he goes into the exam room, and I think he knows that Sergeant Garcia is ready to go, and I think we're going to pick up with Dr. Jackson at this point.
And as we pick up with Dr. Jackson, keep in mind that your physicians are able to be in the chart at any point in time. In fact, we're not limiting the number of users that can be within that record. So even when the medic is reviewing the information, updating that, your physicians can be in there getting prepared for that appointment at the same time. Now, as we do go ahead into the record, you'll see here that the home screen is very similar to what your medic had. So not learning a different way to review this information. I too can see the status of how long the patient has been here. And now that they've been in multiple different statuses, we're seeing that break out to how long they were in each portion and that total time in clinic. Not only can we see it right here, but we can actually run reports off of this information, throughput analysis, ensuring that those clinics are running efficiently. Additionally, as I'm taking a look at my schedule, it is really much more than just a schedule. It's helping me to organize, or Dr. Jackson to organize their day, keeping track of what things need to be done, not just what patients need to be seen, but should there be any outstanding activities like notes to be written, visit summaries to be printed. That's all here to help us keep track of that information. At this point, let's go ahead and go into Sergeant Garcia's record. as we go into his record, the first thing that I'd like to do is orient you just a little bit to the screen here. Across the very top of the screen, you'll see that there's a demographic bar. You may have seen this when Stephanie was in the chart as well. This bar is going to be there no matter where you are in the record, always pointing out what patient you're looking at, as well as very pertinent information. Things like the fact that Staff Sergeant Joe Garcia is special duty status, as well as he has updated allergies. Those were just done by Stephanie, and we already have that information, and should we place any prescriptions that interact with that information, it would automatically run that for us there. Now, as we take a look at the rest of the chart, the body of it, you'll see that this is his medical record. And the medical record is intuitive enough to know where Sergeant Garcia is. He's currently in the outpatient clinic, so it's automatically opening up to the ambulatory workflow. When he was in the emergency department, it automatically opened up to the emergency department workflow. If he went to the inpatient facility, he'd open up to the inpatient workflow. You get the trend here.
I think it's important to really point that out. We know that some of you have been wondering, how am I going to know where my patient is, or am I going to have multiple logins? This is all within one login, whether the patient's being seen on the inpatient side or in the clinic.
So one space and access to all of that information. In fact, as we focus in on that ambulatory workflow, keep in mind that all of those items within that along the left-hand side can be personalized to the individual PCM, having that ability to drag and drop those so that they display in the order that that individual likes to review that information. Now that's great for PCMs, but we know the world is not made up just of PCMs. We also have specialists, things like cardiologists, neurologists, oncologists, all of those pieces there. And I want to assure you that whenever a specialist logs into the EMR, the chart actually adjusts based off of that specialty. Still using that one single integrated record across all of MHS GENESIS, but displaying the most pertinent information to them on the very first screen. Now, enough orientation. We've made Sergeant Garcia wait long enough. We don't want our numbers to get worse here, so let's go ahead and continue on with this visit. Now, as we are reviewing his chart, we can see that he's coming in for that follow-up to the emergency department stay. In fact, we can even take a look at those latest vital signs that were just entered in comparison to what has been happened previously, and even trend them so that we can see those over time.
Hashtag vital signs, hashtag trending.
Hashtag hold up, Stephanie, not that kind of trending. You can see here that it's actually trending on a graph there.
Hashtag sorry.
Yeah. Guys, I don't think our jokes are very funny. Come on, guys.
More coffee.
This is fun. But it is, you can see that it is trending over time, so you've got access to that information right there real time on the screen. In fact, as we do continue to review the chart, I'm going to focus in on the documents. This is really where you can see the value of that one single integrated system. We're seeing all of the documents over time, including that emergency department note that just occurred at another facility. So we can quickly review that information, open that up right within the chart, and have a true understanding of what occurred. I'm not relying on Sergeant Garcia's memory anymore of what happened. I can actually look at that right within our chart.
Wait, so Megan, we need to probably step out and look at this, reiterate this. She's not logging into CHCS or HAMES or, I don't know, Alta maybe? I can't keep track anymore.
There's a whole bunch of them.
We're staying right within one login and one view.
One view, and you've got access to all of the information you need, and more importantly, it's formatted for you in the outpatient clinic, bringing you that information you need at this point in time. In fact, as we're reviewing that note, we can see that there was that x-ray done. We heard about that in the video, but we have confirmation that that was done within the note. We would like to take a look at that. Don't have to go anywhere special for it. In fact, we can take a look at that report right here within that chart. In fact, as we're reviewing that, we notice there's some things that we'd like to include as a part of our note for the day. So I can quickly tag that information, and as I tag that, that will now be available within the note that I create for today's visit. So I'm no longer having to copy and paste to bring information in. As I'm reviewing the chart, I just quickly mark and tag that. Now note, you can also take a look at the image if you wanted to open up that image, but we just took a look at that report here real quick. Now, as we are going on, I'm going to fast forward just a little bit here. We'd continue to review the rest of the patient's medical record, ensuring we have an understanding of what's happening with him. As we do come across his chronic conditions, we see that we're lucky we've got a relatively healthy individual here, not too much going on, but I do need to add in that diagnosis for today. As we're adding in that diagnosis, you'll see that it begins coming back with the results as we're searching for it. So no longer am I having to remember exactly the way something is entered. I can search for it real quickly and add that in. It does, now that it's added in the chart, it will be available for me as I'm placing orders or as we're doing any sort of coding throughout his visit. At this point, we have a really good understanding of what's happening with him. We've had this conversation back and forth, and I'm ready to begin documenting some of that information. As I do start documenting, notice that we're not going to a special documentation tool to do this. The review systems, the HPI, the review systems, the physical exam are all right here a part of that same workflow. You can even put these items off to the right-hand side so that you can have access to those while you're reviewing the chart at the same portion of it. Now, as I'm entering this information in, know that your clinicians will have a few options for putting these in. They can use free text, or I know that some of your users are using Dragon today, so they could use voice recognition to quickly enter those pieces in.
I know I keep interrupting you, Meg. I'm really sorry, but I just want them all to know that clients like yourselves are saving in cost and improving on efficiency just by implementing dynamic documentation and voice recognition. I think even Memorial Gulfport saved $1 million in implementing this. Pretty powerful.
Not to mention your clinicians like that ability to quickly be able to put in that very narrative story of what's going on with that particular patient. Now, for my review systems and my physical exam, instead of entering each of those out individually, I'm going to use some quick code words to enter in some standard text. Now, as I enter those in, you'll see they expand out to what I typically would enter as a part of this process. Now, this is great, but we know that no patient fits within the standard or the norms of a template. So they are completely editable. You can go in and adjust these so that they are worded the exact way that you'd like them to be for Sargent Garcia. Now, as we're updating and putting those pieces in, we're having that discussion of what are our next steps for him. Those next steps, we'd really like to get him sent home with some prescriptions, maybe some physical therapy. So we're going to place those orders for him real quick. As we're placing those orders, you'll see that we can quickly search for them, finding the prescription that we'd like to have. We'll send him home on some ibuprofen 800, a little bit more than what he was getting when he went home from the emergency department. So I do want to also send him home with some Pepsid, make sure we protect his stomach as he goes home and is going to be on this for a little bit of time. I also mentioned that we're going to send him home and get some physical therapy, making sure that we can get him back to that active status as fast as possible. So as we place that order, keep in mind that you can have favorites, and physical therapy is perhaps something that Dr. Jackson places on a regular basis. So instead of having to remember the details each and every single time, we'll quickly add that in from our favorites. Now, as we've been adding these orders, both prescriptions and physical therapy, they've been going up to my orders for signature box. Think of this a little bit like your shopping cart. I think you guys have heard that one before. But you can see here it automatically puts those in, and as we sign off on them, they're going to disperse to the appropriate locations. Note that physicians will also be able to see what is on formulary for the pharmacy that you guys are Staff Sergeant Joe Garcia would be picking this up at. After entering and updating those orders that have been completed, know that that's been building the assessment and plan as we've been going. So as we were entering in the diagnosis, as we were placing in those orders, notice that that assessment and plan has been built for us. I just need to quickly add in the additional narrative portion of it, and I could do that via any of the methods of documentation we've discussed up to this point. At this point, we've spent the majority of our time working on this workflow. In fact, 95% of that time is spent right here. And just the very last step, that last 5%, we're going to compile this into a document that's created as a byproduct of that workflow. So now all that information that Stephanie did, that I did, is all being brought into that one single document. Anything that was tagged along the way is going to be along the left-hand side, and you can quickly drag and drop that into the note. Notice that it's not just a text there. It's actually annotated, letting us know where that information is coming from. So whether we review this note in the future or another individual reviews this note in the future, we know exactly who's completed this documentation. Now, let's pause. I know I'm doing a lot of explaining here, but I bet you anything you're going, gosh, this note looks a little bit different than notes that we've seen in the past.
Looks pretty good. 1 page?
Yeah, 1 page.
Yeah.
Imagine that. We're not going to print this off and get 15 different pages of notes as we're going through this, and we're not going to have to flip to the very last page to see the assessment and plan. In fact, as you're looking at this, along the left-hand side, you've got that story. What went on during today's appointment? What's the plan? What's our next steps of what's occurring? And then on the right-hand side, you've got that reference information. What medications are they on? What's their family history? So that you can quickly glance over and get that while you're reviewing the pertinent information from today. It is completely editable at this point. It's like your print preview. Everybody always did that when they were writing a paper, make sure it fits appropriately, looks good. We'll do the same thing here. Luckily it does, so we'll go ahead and sign off on that. As we are signing off on it, note that any of your residents or your medical students would be alerted to put in their attending provider at that point. It does update the patient's medical record. Now everybody who has access to MHS GENESIS will be able to review that note and see that over time. In fact, even our physical therapists would have access to that as they're reviewing that. Now, as we go back out to our homepage to continue on with our work with our rest of our patients, before we go on, I do want to talk about what's going to happen from here for Staff Sergeant Joe Garcia. He's going to go ahead, and as he's leaving the clinic, we're going to update his status to not inactive. I'm going to say the wrong thing, Stephanie.
Limited.
Limited, thank you. We practiced that part. We're going to update him to limited, not inactive. Let's not go that far. We're going to update him to a limited status so that we know where he is at within this process. And we are also going to make sure that he gets his visit summary as well as any education sent with him. Now, he could get that on paper, but we're going to be a little high tech here. We're actually going to send it right to his patient portal so that he has his visit summary, his patient education, his profile, all available to him from there.
One more reason for him to love his patient portal, right?
Oh, absolutely.
He doesn't have to have his paper in the back of his pocket. He's washed his a few times, by the way, but now he has access to it electronically. That's pretty cool. All right, so now that we've seen that clinical view with Sergeant Garcia, we're going to head out the door with him over to the pharmacy. And as we're heading over to the pharmacy, he's going to be checking in with that pharmacy tech. And upon checking in, they're going to scan that CAT card for him, ensuring that he has that prescription coverage. Don't worry, he does.
Yeah, and think about that. We know that he has coverage. He was just seen in the clinic. But think about your patients who are coming to pick up refills. No, we don't have to have that gap in wondering whether or not they have that eligibility. We can scan that CAT card in real time. We know that information.
Absolutely. And after pulling up his information, you will notice once again that banner bar available to us. Just like we saw that with the clinicians here, we have all that information pulling in here. Now, over on the left-hand side, we also have the demographic details updating from that clinic visit, those allergies that we documented as the medic and the physician, all pulling in for the pharmacy. Now, we do see those prescriptions that are ready to be filled, and so he can get out and out the door. But before we do that, we can even dive a little bit deeper into Sergeant Garcia's story here and look at those results. We see those results pulling in as well. So that pain score that the medic updated earlier on in his visit, we can see that pulling in all right here. So we know that what's going on with Sergeant Garcia. Why is he picking up those prescriptions?
And this is great for Sergeant Garcia, but think about your other patients, maybe even a patient who's taking an anticoagulant, maybe warfarin. Right here within this workflow, your clinical pharmacist will have access to things like the INR, the PT, the PTT. They're not having to go someplace else to see that. They've got access to that in their workflow reviewing this information.
Now, you know that also within MHS GENESIS, if he wasn't coming to this or presenting to this pharmacy, they'd have access to this information as well, all the other clinics. So this is great for Sergeant Garcia. If he doesn't stop by this pharmacy, he can maybe head on over to Oak Harbor or wherever it may be. He'll be able to get those prescriptions. So let's go ahead and take action on these prescriptions for Sergeant Garcia today, get him out the door. here. And as we do this, we will notice that we're going to be able to pull in that information from the orders that the physician placed. So no longer are you having to call up to that physician, even though I know you guys love talking to your physicians as a pharmacist, but no longer you're going to have to do that. You can see all of the order details pulling right in here. Now, along with those order details, we also know that you're also having to dig through that information on the certain prescriptions that need that med guide. No longer will you have to do that. It's going to prompt you on those prescriptions that need that guide and that's available for the patient. So after looking at all of this information, it looks good. We're going to go ahead and get these filled for Sargent Garcia today and get him out the door, ready to go and ready to go home and improve his health and get him back to that readiness.
Yeah, but we know that our care doesn't stop for Sargent Garcia when he leaves the clinic. In fact, it doesn't stop for any of the patients that you're caring for. We know there's lots of things that you're doing in between and after visits to take care of all of your patients, maybe even keep them out of the clinic and manage that at home a bit. Now, one of those things that's really going to help you within MHS Genesis to help manage those in-between and after-visit activities is going to be your message center. So remember that homepage that both Stephanie and I had when we were logging in to the system. We have got access to all of our messages that are going on. That message center is going to contain things like messages from our patients. We saw that with the message from Sargent Garcia, that image that was coming across. We can also communicate back to them right from here. We can communicate with other clinicians. We can get notified of things like laboratory results that are coming back. So when we send our patients out to get that done, we know those results are coming back and even communicate directly out to them from here. Or even thinking specifically about Sargent Garcia. We sent him out to get physical therapy completed. We can continue to stay up to date on his status, that progress of what's going on with him within that message center along there, and even making sure that we get him back to active duty status. One of the other tools that you have is, and that you're seeing right here on the screen, is dynamic work list. So the message center is great for those things that you really need to focus on right now, but dynamic work list actually gives you the ability to be a little bit proactive about this approach. You can actually run lists of patients based off of multiple different qualifiers from here. For example, you could run a list of all of the patients that have a certain condition. You could run all of your patients who have not had their annual eye exam completed and actually send out a message to them to hopefully bring them in and get that completed in a timely fashion. Or thinking again back to Sargent Garcia's journey, we had him, the whole reason that this process started is that we had him come in after being discharged from the emergency department. And we know that we have a timer behind that we need to do that in an efficient process. So you can actually run a list of all of your patients who have been discharged from the hospital or from the emergency department within the last 72 hours, and then you can communicate directly to them via their preferred method of communication. So instead of relying on Sargent Garcia to remember that he needs to complete that in a timely fashion, we can be proactive about that and get that process going here. And in fact, those are many of the tools that you have. There's many more a part of that process there, but some of those tools that you can help to manage your patients through that. Now, we focused a lot on managing your patients or managing Sargent Garcia, but what about your clinicians? What about the folks that are using MHS Genesis?
Speaking of that, Megan, and I think most of you have been asking about that this week and over the past year.
Hot topic. Everybody wants to know about this.
Absolutely. So I'm sure some of you, maybe this is the reason why you came here today. You didn't care about Sargent Garcia. You wanted to hear about Cerner Advance and Lights On Network. Now, as I mentioned, I know a lot of you have been asking about this and wondering what the details are behind it. And we saw Sargent Garcia today in the clinic through his patient story. We inputted a lot of data clinically and even from an end user perspective as well. What's great about these tools is it's going to be able to track that information that you're putting in as the clinicians and be able to dive a little bit deeper into how you all are utilizing the system across your organization. Now, we do know that when it comes to HIMSS, you're looking at those certifications and tracking those percentages from a CPOE perspective and trying to get to that HIMSS level 6 and 7. This tool is going to allow you to pull in that information and utilize that to really achieve that goal. Now, in looking even a little further into our end users here, we can also drill in and even look at specific users that might be needing a little help or some training in utilizing the EMR and how they're seeing their patients. So since we were on that ambulatory story, let's go ahead and take a look at those ambulatory physicians here. Upon looking at these physicians pulling back, we have a number of ways we can take a look at what's going on with them, whether it's the volume of patients they're seeing from a month-to-month basis. We do see here Dr. Ahmed seeing quite a few patients every month, and we want to take a little further and look into how he's utilizing the system.
Gosh, there were some big things that popped out to me the second that we got in here. You can take a look at this in real time, right, or in near real time right here at the top. We can see the potential savings that we have for Dr. Ahmad. 3 hours and 20 minutes is the potential savings that we have for him. That's quite a bit of time that we can actually give back to him to continue that care of those service members and their families.
Absolutely, or, I mean, who knows, he could watch a marathon or something. I don't know. Do you guys like Game of Thrones? He could watch that. You probably should see more patients, though, I think. But along those lines, we do know that we've also been hearing that you're worried that maybe this is really going to focus in on who the problem child is or who the problem physician is. Rest assured, we're not trying to call out that blue falcon. However, we are just really wanting to help you better use the system so you can see more patients or you can spend more time with the patients you're seeing. Now, looking here, Dr. Ahmed is struggling a little bit in that chart review. He's actually, against his peers, his specialty, he's doing double the time in the chart review. So we want to look what's going on there. Why is that happening?
This is great. We don't have to guess where we need to spend time with him on. It's not the ordering portion. It's not the documentation portion. It's in that chart review. So knowing where that opportunity is.
So even looking a little further into that chart review, we can also narrow in on that information of how he is reviewing his charts with his patients while he's in those visits. Now we can see here that maybe he should probably take back or spend less time in those flow sheets and really utilize those in pages like we saw with Dr. Jackson today. We can really narrow in on that information here and see how we can give that shoulder-to-shoulder training to help him enhance his experience within the system.